day, everyone. My name is Dr. Emmanuel Okbi from Planned Parenthood Federation of Nigeria, national headquarters. And right beside me, I have Dr. Papka Marian. So,
good day, everyone, and welcome to another exciting episode. Today, we're here to talk about the different methods of contraceptives. We want to break them down into the traditional and the modern methods. But for time, we're going to talk about just the traditional methods today.
Sure.
Yeah, so for the traditional methods, we're going to start with abstinence, which we all know is the 100% most effective method of contraceptives. However, this is not possible for the married couples and the rest. So now we're going to move on to the coitus interruptus.
Okay, coitus interruptus, which is, fondly called a withdrawal method.
Yeah.
Now, this is, the practice of withdrawing the erect penile organ during coitus or sex from the sexual reproductive organ of the female just before ejaculation.
Yeah.
And we have lactational amenorrhea.
Yes, lactational amenorrhea, we all know that it's just simple medical terms. Lactational means during breastfeeding, amenorrhea means no menstruation. So some women, when they're breastfeeding, they do not menstruate, which means that they do not ovulate and cannot get pregnant. However, this is dependent on if you exclusively breastfeed. As for some women who are not exclusively breastfeeding, there might be that chance of taking it. So it's not a 100% effective method. So we will not advise that one will stick just to that, okay?
Yeah.
So
I've had so many pitfalls from that.
Yeah.
Okay, we're going to talk about reading method / calendar method and safe period. Basically, we know that the menstrual cycle has a length of time or number of days that it covers. Mm-hmm. So the average is 28 days, but medically speaking, we take 21 to 35 days. Mm-hmm. All right. So it's expected that at the middle of this time, or let's say taking 28 days now, the middle, which will be the 14th day, a woman is expected to ovulate. That is the releasing of eggs from the ovaries into the vaginal vault. Now, around this time is when the woman is most fertile. So if you do not want to get pregnant, it's safe not to have sex within that period, because spermatozoa or sperm in semen can survive for a number of days. So it's the best practice would be to abstain 2 days before your ovulation period and 2 days after, just to be on the safe side. But still, there's no 100% guarantee with that.
And then if you're going to use this method, then you have to be sure of your menstrual cycle. You have to monitor your menstrual cycle for at least 6 months consecutively, noting the dates down, so that you'll be sure that you have a regular menstrual cycle before you can do this. So after 1, 2, 3, 4, 5, 6 months of checking your menstrual cycle and you're sure of your days, your number of days, then you can take the 14th day, and then you can do the 2 days before and 2 days after. That's basically day 12 to day 16 of your menstrual cycle.
And some of the things you can look out for would be a rise in your body temperature if you've been keeping a chart. So you notice that on the days or the time when you're ovulating, your body temperature rises by 0.5 to 1 degree Celsius. And then also the effluent or the cervical mucus that the vaginal secretion or discharge becomes thicker. So these are all pointers to the fact that you're ovulating around that period. And also there is an increased urge to want to procreate. So the body pushes you to want to have sex, because first rule of nature is self-preservation. So if you're ovulating around that period, it's only natural that the body would want to fertilize that egg.
Yeah. So having said that, we're done with the basic traditional methods of contraception. So next episode, we're going to talk to you about the modern methods. Today we're just going to list them briefly, so you know what we're going to talk about. We're going to talk about the reversible and the non-reversible modern methods. We're going to talk about the oral contraceptive pills. We're going to talk about the injectable methods. We're going to talk about the condoms. We're also going to talk about implants and the intrauterine contraceptive devices. So thank you so much for listening. However, if you have a question, you could send it to email.
Questions at ppfn.org, or you can follow us on our different handles on Twitter, which is at PPF Nigeria, and then on Instagram, PPF Nigeria. Thank you.
And don't forget to check our website, www.ppfn.org. Thank you for watching.
I love that. Thank you. Have a wonderful time. Smith's Beats.